It's about to be a new year, but not a new situation in the coronavirus pandemic. You might be excited to say goodbye to 2020, but don't expect for it to look any differently, at least early on. In today's 2-Year Well-Being, we are talking about important steps for a safe and healthy 2021. Family medicine physician Dr. Zoe Stallings is with primary care at Pomona, a member of Cone Health Medical Group. She's joining us now. Thanks so much for being here. Let's start with the vaccines. A lot of people have questions about that with the beginning of the rollout. Would this mean we could possibly stop wearing masks and social distancing as many people start to get vaccinated?
The vaccine is not to replace the mask. We still want you to keep your mask and still observe those 3 W's, wearing your mask, washing your hands, and making sure that you keep space between you and the next person. What the vaccine's aim is to help our immune system get further along so that we create those antibodies to help us fight the infection. So similar to the flu vaccine, we still want you to maintain the proper precautions, but the vaccine can help long-term reduce the severity of the illness, as well as protect those who are the most at risk of the worst outcomes, such as our elderly, our people in healthcare, even our young children who have underlying conditions. So we really want to think about it as a way of decreasing the severity of disease, preventing in the future. But for now, the mask is still going to be critical.
I'm glad that you brought up the 3 W's. A lot of people were wondering how important is it as we enter the new year to be doing those 3 W's. How long into the future do you think we'll be required to do this?
I think that in terms of what we're learning now about how we are a global community, our thought process in the healthcare community is that if a disease or a virus starts in one country, it could be across the globe in a matter of hours. So I think going forward, we should make it a part of our regular practice to wash our hands. This is not something it shouldn't be new, but we had to emphasize that. And it needs to be a part of our culture to always cover our mouths when we sneeze. And there might come a time in the future where we don't wear masks, but it should always be ingrained in our awareness, our consciousness that we need to protect ourselves and others around us by keeping our microbes or bacteria or viruses to ourselves, because that's how we get other people sick. What's in your body can make somebody else very sick. So going forward, we should always wash our hands. We should always cover our mouths. And we should definitely try to make sure that when we're in public spaces, that we are a little bit more aware. I think that should be a cultural shift for the future, whether we are in the mask in 4 years or not. But at the point that we are now, I think the mask to me is a minor sacrifice, and it's something that we can easily accomplish, and it's still quite cheap. So I think it should be here to stay for at least another year.
When it comes to social conversations and that kind of stuff, how do we maintain healthy social emotional interaction for good mental health in the new year with numbers rising, even if we do continue social distancing?
Absolutely. I know that I miss hugs, and I'm one of those people who would greet people. And so now it doesn't mean that my warmth is not there. What it means is that when I bump elbows, I greet with a brighter smile. I've seen my dentist twice so far to make sure my teeth are what they are, because from a distance, you can see that smile. When I'm close enough to you, if I'm within arm's reach, I'm within 6 feet, I'm covered in that mask. But what I try to do is I use positivity as my greeting. I wish people good health. I emphasize to people who are going through a hard time that I pray for them. I talk with people about their struggles, and I feel like I'm more connected emotionally to people now that I can't touch them with my hands. I can touch them with my heart. So I do want you all to think about reaching out with your emotions more than you reach out with your hands, because the germs on your hands can hurt people, but the good, warm feelings in your heart in 2021 can really do a great deal to help others.
And I don't know about you, but when I am approaching someone and I want to show them that I'm happy to see them, I try to smile extra big, behind the mask, because you can see it in people's eyes and in their cheekbones.
You can. Very true.
So what elements of a healthy lifestyle are key as we enter another year with coronavirus?
So I still think about one of the keys for us, especially for people who may not have made that time or that priority of going for their checkups, is to think about, I want to be healthy. So maybe you are not going to be one of the first to get the COVID vaccine, but what about the flu vaccine, the pneumonia vaccine, your tetanus? Get those vaccines. That's a huge part of your preventative health plan. Talk to your doctor about screenings. Are you 50 and older? Have you had a colonoscopy? You can contact colonhealth.com and find a primary care doctor to do those screenings. In the community, you might even see a mobile van that is doing mammograms. Reach out and get your checkups, because staying healthy, our health has been such a resource. We've emphasized that. We want you to stay as healthy as possible and to be as proactive as possible. So in 2021, we want you to think about exercising, eating your fruits and vegetables, thinking about your mental health. Now that many clinics are seeing such a volume of anxiety and depression, at Cone Health, they have embedded mental health within the primary care setting to get you started so that you can address your anxiety and your fears. But also thinking about things that are hereditary. If you see that there's diabetes in the family, be proactive. Because once again, people who have had the worst outcomes are a lot of people who have had underlying conditions. So let's work on those underlying conditions in 2021. And some of those starting with a healthcare screening.
With the continued rise in coronavirus cases, some people might be considering delaying care. What do you say to that?
So I've heard patients ask me, can I go to my eye doctor? Can I go to my dentist? I don't want to get my colonoscopy because I have to go into a location. I don't want to get a mammogram. And what I'll tell you is that many of the times, the measures that are taken at the desk to check in, to even get your blood drawn, you have to show up in a mask. You will not be allowed into any healthcare facility without a mask. But also, we are prepared for you. We get up early and we get to work and we sanitize for you. We do this to keep you safe, but we also do this to keep ourselves safe. And what you're doing is, this time is a time when we really need to double down on staying healthy. And so my plea is, that dentist who woke up early to get there is waiting to screen you for gum disease and oral cancer. Because oral cancer and gum disease, they're not going to sit back and wait because of the pandemic. It still is going on. Colon cancer. We've seen women are still diagnosed with breast cancer getting chemo at the breast center. And we've seen where their specialists show up for them. So don't delay your care, because we are right there with you and we're waiting for you. We are cleaning, we are sanitizing, we're maintaining distance. We have created virtual visits so that we can do some of that work virtually. But we are in this business to keep you healthy, and we're waiting. We're here to serve you.
Any other good recommendations, maybe even New Year's resolutions for 2021?
I remember a year ago, this conversation about New Year's resolutions. And what I would tell people is to think of it as each day is another opportunity to do something well for yourself. So instead of a big laundry list of resolutions, I would encourage patients to think about, maybe I could exercise for 25 minutes instead of 15. So making measurable small goals that will achieve a bigger goal down the road. Also, thinking of ways that they can even work on some of their finances. This is going to be a time in which people are either downsized, their jobs are changing. So think about ways that you can save, because the leading cause of stress right now, besides health, is finances. So think about how that will impact your overall well-being and making those measurable goals. But I always emphasize, start with exercise, think about sleep, and think about a balanced diet. And once you achieve those, add on a few more goals. But I think baby steps might be the key for 2021.
Reminds me of one of my favorite sayings, that it is a marathon, not a sprint. So
absolutely,
take it slowly.
Absolutely.
And you'll get through it. Well, Dr. Stallings will be here with us until 6 o'clock answering your coronavirus questions. You can text them to us at 336-379-5775. We'll be right back.